Hey everybody, and welcome to Coco MD TV, where we talk about mind and body matters, because both your mind and your body matters, which is why I'm about to go work out. But anyway, today is part 3 of Unstable Moods, where we're going to talk about borderline personality disorder. We already talked about PTSD being a cause of unstable moods. We talked about bipolar being a cause of unstable moods, straight up just poor distress tolerance, kind of like needing to mature in your interactions being a cause of unstable moods. And now we're going to talk about borderline personality disorder. Before I jump into that, I want to give you a little bit of history about the name. In the 1930s, when the doctors were caring for this patient population, trying to figure out how to help them best, they were figuring and finding, assessing, observing that they were bordering on psychosis and neurosis. It was kind of like overlapping, jumping in, quick transition in and out, experiencing realities like differently. So they coined the term borderline. And so before I say anything else after that, I want to say you can get better. It's not like a cure because it's not a medical condition, but you can get better. There are treatment for that. Most of it is talk therapy, but you can get better. So according to Mayo Clinic, there are about 3 million cases per year of borderline disorder, borderline personality disorder. That's a lot. Okay, and then I'm going to tell you why this is important. This is important because people with borderline personality disorder utilize a lot of healthcare resources. There are a lot of hospital admissions, emergency room visits, and a lot of medication trial and error, and that's important. So we need to figure out a way to help. Also, approximately 10% of those with borderline personality disorder complete suicide. That's too high. We need to figure out a way to help them as well. And also because when you have borderline personality disorder, your relationships and things are affected, and we need to find out a way to help affect change in that area. Okay, I'll try to give you guys a term that helps me to understand it. I don't know if it'll be helpful to you, but this might be helpful, I don't know. If you think about borderline personality disorder as an interpersonal hypersensitivity. So very sensitive to the way I'm receiving them, the way they are receiving themselves, the way they think, whether the way they think about themselves, the way they feel that the world is receiving them, just a hypersensitivity. So this is a personality disorder, which means that this is over time, this is developed and usually starts in adolescence. So it's not like we can diagnose like a 5-year-old with borderline personality disorder. Usually, how does this happen? How does this come about? This is a more nurture than nature kind of thing. So I see a lot of times people who have unfortunately been in traumatic situations kind of develop this complex PTSD personality that kind of turns into a borderline. And remember the kind of object lesson that I did with the orange last time, that when this person has a bit of pressure or stress on them, these are the things that come out, these flavors. And I was going to give you guys the DSM-5 diagnosis, but it's not important because you need to go to a therapist, you need to go to a doctor in order to get diagnosed. So don't worry about the DSM-5 definition. I'm going to give you 4 that help me to characterize this better. Number 1, there are going to be symptoms and things in their mood. And what I see the most is this overwhelming, profound sense of emptiness, like just totally empty, nothing there. And it's a profound thing. Of course, and you can imagine that would make somebody feel really, really sad, but that's the mood component of it. The second thing is impulse. High-risk behavior, spending money, drug use, increased sexual behavior. And now you can see, if you watch the bipolar video, why this sometimes gets diagnosed as bipolar. Because if a borderline person, if a person with borderline personality disorder is in a stressful situations and begins having these issues with their mood, and now they're impulsive, and they come to attention, and maybe in a hospital or something, somebody may quickly think that it's bipolar. But the difference is it's not episodic. So there is a start of a manic episode, and hopefully when it comes to medical attention, a stop. However, in borderline personality disorder, this is who they are in times of stress. And then the third thing is cognition, the way that people think. And if you can think, they kind of like, so somebody with a borderline personality disorder may have these brief psychotic episodes. Like, it's just like, you know, you said that you were leaving them and then they try to throw themselves out the car, or they cut themselves and kind of like they're not really thinking, right? Or they can dissociate. So the thinking is in periods of stress is not the way you and I would think. And that's why a lot of times they do come to the attention of doctors, and then they may benefit from medications for a short period of time. And then the fourth thing is interpersonal. So interpersonal relationships. So stormy relationships, codependence, and intolerance of aloneness. So you can see that, and it's funny, this is what my dog is intolerant of being alone, and this is why she's scratching me right now. But anyway, intolerance of aloneness. So I didn't say before, but there's like this intense fear of rejection and abandonment, as well as this intense desire for closeness. So if your intense desire is like, and you have this intense fear and it actually is being realized, you can imagine why somebody would become kind of like not thinking the way that they usually do. So let me just talk about this. Also talk therapy. There's a special kind of therapy. It's called dialectical behavioral therapy, DBT, which works very well for people with borderline personality disorder. So the take-home points is borderline personality disorder is not bipolar disorder. People can get better. And if you have any questions, please send me an email, comment below, like, share, subscribe. Hope this has been helpful. I don't know, but take care. God bless.